Morning. It is July the 6th. Minister Hickes will give us some updated numbers, and Dr. Patterson has a statement, and then we'll go into questions. Thank you.
Ula sa kulong July 6, Minister Hickes ukausit sa kalangayok ang maluluta Patterson ukalimatak ko apersusitak ko.
Thanks, Kate. Good morning, everyone. There is still the one presumptive case of COVID-19 in Nunavut at the Mary River Mine. Again, I want to stress how isolated this case is and that Nunavut do not need to worry about the spread in this instance. The total number of total persons followed to date is 1,467, and with 157 people are currently under investigation. I just wanted to take the moment to recognize that on Thursday, this upcoming Thursday, Nunavut Day, and while we don't have any community-wide celebrations like we usually do, I hope that everyone is still able to celebrate our incredible territory safely with friends and family. We've come a long way over the last 21 years, so let's enjoy the day and keep working hard for each other, our communities, and the future of our territory. Happy Nunavut Day.
Ula sa kut sulite na tao si pasagiyaw yok no badyanak 19 ham naraktaw yok no navumi nuluya uyarak nerbingani. Uhaw sa kakan na ako mayong ataan na to naraktaw mat amalo no navumi isumalo atong ito siya makayak ningani tat samangat. Katili mga tugita ko kawi saktaw si mayo ulumimot 1,467 157 sulew dakyaw yok kawi saktaw gutingin ni. Nunavut ulo kailangan ako si tamermi. Tayo mano nalin ko kaya so guta kalangi kalwak tu tayo may hatta kayo kalwak suta kisya ni kaya so hubatsi taman na piyo yumikat janak to minun at tinni at tanang itukut bikan na kaya nut ilagi yak nulo tiki utis si mayugo akago nit huani wanik amisuni pilira haksimaluta kaya so lako ulungani amalo at so tayo nakta pilira hatigiluta nunak katitinut amalo nunabumisibo ni chatinut Nunavut ulungan ko kaya sulakasi.
Good morning. We are still waiting on confirmatory results for the presumptive case detected in the Mary River Mine, with the expectation that they will be ready sometime this week. The Department of Health continues to monitor the situation at the Mary River Mine site closely, and we will provide support as needed. I want to take this opportunity to remind Nunavut that testing is only one component of the public health response to COVID-19 outbreak. Testing is important, but it is not a replacement for social distancing or hand washing. Testing is important, but it is absolutely not a replacement for 14 days of isolation.
Ula sakut suli utak kiyugut nalo na tao gasoar ningin ni kawi sa kutiyo yutat sumunga pasagiyaw yumo kawi yaw lok tumo nuluyani uyarak nerbingani niriyunak tunitaba ni pinasa ako sa miutilar ningani aneham nang itulirikut kawi sak palya ningin naktut nuluya uyarak nerbingani amalo ikayok suigum na nertu ikayok tao gaya kakata pibiham nini ikaitit sigumayunga no na bumiunik imak kawi sa hatam nektan na ilagi yaw tuwin naktok ana ham nang ituliri nak mo kamawalya nak mo nuvadyo nak 19 siya mapalya ni ngani kawi sa hatam nek pimariyo yok kisiyani kingo beauty yung itok ino katigit kanigilo at tailigahang nangin ni kumbalo ni agkasin ni wasay na katarahang namin kawi sa hatam nek pimariyo yok kisiyani kingo beauty gunang itok tal kuning ulo ni 14 nik inutukay na katarahang namin.
The government of Nunavut follows testing guidelines and best practices that have been endorsed by the World Health Organization and Health Canada. We rely on diagnostic devices that have undergone rigorous validation and accreditation processes to provide dependable testing to Nunavut. Even under ideal conditions and with validated equipment, testing is not always a reliable method of identifying cases of COVID-19 and halting transmission. There is strong evidence that false negatives can occur throughout the incubation period.
Nunavut pa makuwit kawi sa palangin nakto kawi sa kutiyo at wagang inni kamalo pilirid jusiyot siya nakpanik kayok soktaw sa mayami nunak jwame anaham nang ituliridik ko katod siya katigingin not amalo kanata may anahak nang ituliridik ko nginot. Atutigi kataktabu kawi sa kutiyo yutakwa naluna taut siya si mayut amalo ilisari yaut siya si mayutakwa kawi sa kutit sa katsa kung nakulugin na bumiyo. Akaw na nakpangu galawa ko tamakko naluna taut si mayu galawa kawi sa kuti sunak kutat kawi sa katang naktana naluna sigutilat rilatang gunang itok no badjang nak 19 linnik amalo no kaktit sinamo siya magunang ninginnik. Sakit tahu semayu halari tu tako tam makatak semaningin nik nuwa juang nak tu chau nuwa juang nak suri yau yuk takwa surlu nuwa juang nak kalawak tilugi kawi sakta galawak kata nalu nak tahu gunangiman.
Throughout the COVID-19 pandemic, the overarching goal of our public health response is to identify, contain, and break transmission. The Government of Nunavut will continue to look at emerging evidence and best practices set out by public health authorities, both nationally and globally, to shape our response to COVID-19 and will alter public health measures as and when appropriate. Thank you.
Taman na nuwa juang nak 19 nunak juang misayang mapaliatin lugo. Tukaga kayaw luang anak panguyok anahan ng itulirin ang mutaman na nalo na yaksikat ang siyang maktit sitay amalo. Siya matay lang tatawning ano. Nunavut ka pa magkungit, kawi sa paliangin na niyaktot sakki palia yunik tamak kuning alo. Pilirid jutiyot siya nakpanik. Anahan nang itulirin ng kamayo yunot damani ka natami nunak juali mamilo. Malitaw niyaktot nukat juanak 19 liritillo ta. Asid siya katakayak sutigulo. Anahan nang itulirin ng malitaw kakutaw yun na manasigay pa. So yan namin.
Ken Driscoll, APTN National News. Dr. Patterson, I'm wondering anything you could tell us about the condition of the presumptive positive case at Mary River and the other people that they've put into isolation. Is anyone showing symptoms?
Ken Driscoll, APTN kunik luta Patterson o kau tigun nak pitigutan na kanuilang mga pasagiyaw yok nuluyani nupadyan nak tukang ninganik asingil luta ko inututitaw yok kanuilang mga tema kanuigutikak tuyakan.
To the best of my knowledge, as of this weekend, there's no one there with symptoms consistent with COVID-19. Everyone's well.
Kaya mayak ko tapan ni pinasa ko si unong wan ito sa lawak tangita ko kano iguti hangin nakaktaw yun manaw yun aga kano yung ito ilon natin.
During your statement, you mentioned basically that testing isn't 100%. It's not bulletproof. There are errors that can be made, like we learned in Pond Inlet. Considering that the amount of time that's passed and the amount of people that are in isolation right now without any symptoms, do you think this might be a false positive?
Ano ko sa kakarga bikaw isak tulirin ng mo ilo nang 100% nganit ay tamakon na sungo galwang ila tamakon na sungo ni nganit ay napitay may lawak tumit sa matalimi sa magilugulo takwa kanuingin na taw yo inututi taw yo tay takwa tamak sa matuid na kakaksoki bikaw isak taw gutimining.
It's certainly possible. Hard to say for sure. It could be just a very mild asymptomatic infection that could never have transmitted. There's a few possibilities. And there is a good chance at the end of the day that we're not ever going to know for sure.
Tay may tuin na kailik o kakasawang lagu na lunak tok. Tan kano igot hangit kalawak tilugo siya maksing ito na tuminiw kailik. At jiging ito nagsakit to karon lang kat kasi anita na kayo malaw si mang ito na kailibo tay makano igotaw ning ano.
Going to make for the interpretation. Minister Hickes, it's July and the airlines haven't been paid yet this month. I imagine they must be starting to ask about that. Will the airlines be receiving funding this month? If so, how much and how are those negotiations going?
Minister Hickes, July ngulang ngatak ko hang tayo ligi akilik taw kaya kalalag may mata afiri yung akilik taw kanila mga takinaw yanik malo aji hatigin ni sa kanay palala kaulumim.
Thanks for the question, Kent. And as I said last week, I don't have any update to provide. There is still negotiations and discussions that are going on between Transport Canada officials and obviously airline leadership. So we want to make sure, again, as I've said before, these are public dollars we're spending. We're going to make sure we do our due diligence. But at the same time, we do recognize that there is a continued need for support. We just got to make sure that we're providing the right supports in the right areas.
Kaya nami kent pinasa ako si Jume kayo ga masuli tusakat sa hangin mat suli aye katigi matatako kana tamiloing kayo ligi jo ko tamalo hanga tayo ligi ang yok kautingit tako ga makukina ya katigi magi utsa sa hakata tako lo kayo manlo tasuli ikayok suktaw ga hangin ni kasi ani kayo ga swakti guna manam nakpani ikayok suktaw gutiw na atuni.
Can you put a finer point on the timing? When should Nunavut expect to know the next round of funding that's going to the airlines?
Nalo na kan ni nakhiyo hanga kuno na bumiyo yikaktaw guna lakata ko hanga ko kilaktaw lamang ata.
I can't give a definitive timeline, obviously can't, these things as they evolve, but we are hoping to have some decisions made by the end of this week. So by Monday, hopefully I can give you guys an update a week from now. But at the very least, I'll be able to have a tighter timeline available by then.
Hanga ko gayang mga nalunay laki kong nangitaka taman nasid sa palangin ng mat. Kasi ani isumaliyo ko tikalakti ko kaya pinasa ako siyo nung ani tabani pinasa ako sa me. Kasi ani nagkadya ko lakti may kaya kay kanira akong nalakti ko nalunang ito.
Rajni Sharma, Nunavut News. Dr. Patterson, I know last week you said there were 12 people who had come into contact through contact tracing. Could you give us an update?
Rajni Sharma, Nunavut, piwala yung lagi ikod ni Gluta, Patterson, takwa, 12 muna kayo gabigitat, suminga katiya kaksiman sukiyaw yun. Asingin nito saktit sigakan na rin nakhe.
Yeah, 12 was incorrect. When we spoke to the people directly on the ground at the mine site, there's one individual who's had the 2 presumptive positive results and 7 individuals who have had contact with that person. So
2 presumptive?
2 presumptive tests from one
tests.
individual
Okay.
with 7 people identified as having had enough contact that transmission could have been a possibility. So 1 plus 7.
Tana 12 muna kayo yakata maksiman niyang teko kakatigit sa lok tu kita paano yakang nagbimit tana taw sa kaya sakta minimak ko at itagkatan na pasagiyaw yok amalo 7 gulutik ta ko katita mini usuriyaw yung tat sumunga nalo na taw si ila nalo na taw balya yung tana taw si takamalo 7 katita mini.
Dr. Patterson, last week you also mentioned that the miners get tested once they come into the territory. I was just wondering if you can explain why they don't get tested before they board the plane, before entering the territory.
Luta Patterson, pinasa ako si Yumiyo kayo gabita ko uya nati kaway sakta katang mata tikigay mata sumali aw lalawin ningin itapaw kaway sakta kakatat nila.
That's a mining decision. They're setting up they've made these testing arrangements themselves, and you'd best ask them what the rationale for doing it the way they're doing it is.
Taman no yakan na tulad ko no taman na nalo na ilay sumali ko taos mayo kay makano kaway sakit na mga tatay maay akit si mayo tay ko apere nga ako bigya ka naksawa yak to.
Do you not have a say in how it's done?
Sangin na kangin na biya no kaw tiga ako naglugi ka no tay kamagiya ko yakang mga ta.
No.
Aga.
It's a private enterprise. They've contracted with a private company. We know that one is doing it in the south in another jurisdiction. We definitely don't have anything to say about that. And we know that from the evidence available that putting all of our faith in this testing would, if we didn't keep the restrictions on the miners in place, like limiting contact with Nunavut, under our current capacity, could expose Nunavut to increased risk. So, yeah, I'm not putting a whole lot of stock in the testing because of that.
Tako namin haptiyo matay mikor tutilo timiuningit asingita ko kallo na ni kaw saktaw kay hatak tu galawat asyan abitok si mabiyuni o kasit sa hakbigi ko nang itsakta ka kaw magalawak tu tako kaw sa ko tiyo yut imata tigilo ka hangin at tigo tay mataw isulit tak bakaka ngataw bago tito tay ma Surlo kati silo atele khatta nang mo nga sige khatta ka ham nang mullo tay may taw ngi patakaw sa ko tita tigilo ato ako tigulo na bumeo tay ma sa magbiuli tuin na kaya kangata.
Just to clarify, it's not so much the testing regime or any of those things that they're using or not using. My concern is that testing people who don't have symptoms when we don't know what their exposure history, when it's positive, it's useful, you can do something about that, but a negative result is not a reason to take somebody off of isolation and not a guarantee that they won't develop COVID-19 in the next day or two or something along those lines. So that's why we hold to that firm decision right now that testing is not a substitute for isolation.
Kasi naktigakan ng lugo taman na kaway sa kuti ila kaway sa hatang ni taman na taw na mga taw na ng mga tatigilo kaya kanginati ko ilak surlo kanoy ngito yak to hakkat og balonit kikum ni kati sa yumini mga kaway may nakon nangin nata tay masurlo nuwadjam nak to hangin nakataw galo kakaway sa kuti minikko tay ma kanoy ko te hangilo ni tay ma nuwadjam nak to katuin na kaya hangat ulo ataw simak ulo ni nas malaktilgo tay may mat tay ma tan natatigilo adjang itabut kaway say nakatam nek tamak ko asingin numalik taw galin.
Thank you.
Jackie McKay, CBC News. Can you say how many people have now been isolated at the Mary River Mine?
Jackie McKay, CBC Kunik, o karon nakikatsu lang mga tanuluya o yung nabingan na inutuga hakitaw yun.
We're following along with the mine. I think it's 8 in total, 1 plus the 7.
Tako yung natin ko nalunay sa mayang yamalito yung naktabu tako si tamauyok tut ataw si tana amalo saban ngot tako kati yamin yung suriyaw yun.
Can you say if there's people still coming in and out of the mine?
O karon nakita ko tikikatang mga tao lahat ta sutilo tapang o yung nabimi.
I'm not sure what their schedule is right now, where this case is isolated and we have no evidence of transmission at the mine site. It would be, I'm comfortable with it. If they were to say that they had new staff arriving today, I would be comfortable with that.
How you mangito nga hangat ko hatang mga tikikatak daw lahat takto tanay la pasagayaw yu tanat yu nakakta matamalo sa maksimani nalo na taw sa mangin matay ma kanoy kayang itsak tak kanu tanek kanayak tinitikit to kang nakalak hulum.
Baffinland is saying that there is another person who's isolating because of a contaminated test. We haven't heard about this person at these press conferences, and I'm wondering why.
Bahkan lagu hak semam matatan na inututi tahu yo hang atay na tamma ko tahu nang kau yesa ko tahu nang summa to sa law semangin mga tigo pipalayo liri dito sa kaya tahu katalak tilo.
Our policy is that we'll discuss positive results if they're confirmed or presumptive, and we'll discuss number of contacts who are under isolation when it's over 5. People under investigation or people who are being isolated for other reasons, or what we could be called or what are called indeterminate results. We don't discuss those because they're low, they present no risk to the public, and so that's why we have not talked about any of those circumstances, and there have been cases of indeterminate results in Nunavut. Sorry, Uli, I'm going on too long.
Yeah, too long.
Okay. I'll let Uli translate and then I'll continue.
Ato aga hakat tatay mga ko sa hakat tatjangin at tatay mga pasagi jaw unik kupaluni nalo na taw sa mangitunik tanli mau belanga patau ngata ni ta ko khawi sakta yut inutu ga hakti ta yu asingin ni pijute kharlutik ta ko nalu na ta law ngin ni dai mau lu ga na ko ta ngin matakik ko tu nan no sa magayam ngin ni kay mau khaw sering khatang ita butamat ko pasagi yaw tu naktul.
So there have been a number of times where we've had people under investigation, where we've been following them closely because of isolation requirements, because of indeterminate testing or symptoms, or we think they may have had a high-risk exposure in the south. But until there's a clear risk that could, let me correct that, clear evidence that there could be a risk to Nunavut, we respect the individual's privacy and don't discuss it.
Tana taw sa gani tayo masakit to khatak simayo khaw sakpalle khatak simayo go ino tuga khakti taw yuni mali khatang ata suli khaw sakpalle taw yaw sinak tilugid ubalo khani maguti khakto ya khata ubalo ne khallo na ni kay ma ser maktaw wi bajak tumini ya khata sakit so khak sama matay ma khaw sakpalle khatak ne kinguni ago nalo na taw law tilugid kisane nalo na ila o khaw sigur nak khatang ata.
This question is coming from the Facebook feed. There are rumors about isolation hubs being reduced to 7 days. Is there any truth in that?
Tana pe kuti sama yo Facebook kuti go tayo mga go to sak sama yo hangata ko nailiger taw de hangata ullo it 7 no ullo no taman na suli pa.
No, there's no truth to that. There's speculation in infectious disease experts about whether or not you could use testing to shorten isolation, but there's no plans on doing that, and there's no, I don't even know if anybody's doing the research needed to back up that speculation.
Aga, taman na sulingit dok, taman na isa magayaw si matuwid naktugalo, tamak kuno nga siyang mapanliaso, ni kaniman nang ni kaway mayitarnot, kisane kaway sakta khatal lutitay ma hilame unak sakko inutu khatta harayam ningin ni kisane man na tay ma pang nas mayo hangit dok amalo kaway sakotini nalo na taw si mayo hangin matay manay na taw gunang mga ata inutu ga hakti taw khatam ni.
If we find an alternate way of isolating people, either adjusting the time frame, but it's backed up with good evidence, then we'll look at it at that time.
Asingin ni sa go bigun nakto ni kaway sa kung nakalawak to go kano tigil gunang mga ata kisane nalo na simalaki to ni kaway law nitin ni taman na si jak taw janit sakto.
Thank you. Minister Hickes, please. We've heard a number of stories about people getting kicked out of the isolation hubs for drinking and then becoming homeless. Can you say how many people have been kicked out because of drinking?
To sa mama tata ko ani titaw yo kakatak si mama emir si mayo ni anga yak tunik ang kakakam ni sa makito ti khatsi mga tao kakam nakit.
I don't have an exact number for you today, Jackie. I know there has been issues with people breaking their isolation and having to restart. And there has been a few people that the hotel has refused to take back due to behavioral issues. That's where the challenge comes in, and how do we get those people home? There are, we have mental health people working in the facilities, working with people on a daily basis. It's one of the struggles that we're having.
Jackie kaway mangitong khatsi mga ta kisane to sa khatak si magalwak to sa kumitsi yun tayo maino to ga ham nak minikam malo bigay lakikan na kaya kasungo matato yung mibimiti taw ni ilangit tamak ko ni nalat siya ngito ni to sa khatak alwak to gut kanong luta ko ang kakti taw na mga ta isumalo ti galwak sutigo amalo isumalo kaya ni unlo tamatay kan ato in nakhat siya ngin nakto taman natagat sa ruti giyabo.
Just to follow up a little bit more, when I say it's a struggle, it is a struggle for people going through the isolation. There are challenges. It's you're locked away for 2 weeks, and there seems to be this misconception that this is some type of punitive measure that the government of Nunavut is taking on people. We're expending a lot of resources, a lot of money to help keep Nunavut safe, and we need everyone's cooperation. I understand there are people with addictions issues and there are people with mental health issues. We're doing our best to provide the supports to those people to help them through the isolation process, but has to be some responsibility for the people that are going through as well too. I'll stop there for a moment.
Okay. Kiugia kannerlugutaan tamannaila atsoruuterin iqartara tamakkoinutuuqattarialiit suurluuk isumainnaqigunniiqattangata pinasaaqusiinnimaquunnik tamakkualu ima inertertaugiaq rutiussurijaoqattangata ilanginnut taakkualu kiinoojaqasarna atuqattaqatta taimaa pidjuttiqaluarnerpaangugatta Nunavummiut attanartumiiliqunagit kikkulimaan taimaa pijatsaharngata ikajoqatigiigiaharnermi naalatsiaqaaharnermi qaujimagaluarsuta tamakkua ajuliqutiqarsimayut amalu issumalmiguut akaqqijaaruteqangittut tamanna ikajoqasuaqattartavuqanulimaa inutuugiahartitautillugi taakkuattau imminik inuit naalatsiaqaaharmiyuugalua.
When I talk about responsibility, a lot of the complaints that we receive or that make it up to me are from other people in isolation on the behavior of other people in isolation. There's security that we have on hand. Like I said, there's mental health workers that can help assist people with their addictions. We've put out smoking cessation products availability to people to help with the stresses of not being able to smoke maybe as regularly as they normally would. I don't know what the answer is. We are doing our best to make sure that Nunavut in territory are safe, and this 2-week isolation process is that step that we're needing to take to help keep our entire population safe. And the risky behavior by the few that are jeopardizing not only the safety of the people that are going through the isolation, but also the safety of Nunavut. And I think there needs to be a concerted effort by everyone to do their best, to do their part. There's a social responsibility that we all have in this, and I am asking everyone to help play their positive part in that role.
Uqausahartillunga taakku attuni namminerpileriatsahartiugaluarmimmata taanna unnerluutaujuni tusaqattainaqmiyuugalua assinginnik tamakkuninga tujormivimmiiqataujuni unnerluutiqartunik naalatsiangittunillu taakkua waatsisiqainnarsutik ammalu issumalerinermu ikajortiqainnartuugaluat tamakkualu siggaliamu noqqaqasuarnermuut noqqaqasuarutini atuinnartaqartu taakkua siggaliarturiartuinnaqattarunna ilaqattangata kisaani apiqqutiugu taanna Nunavut attanartumiittailuttaugiaharninga tamaani Nunavummiut taakkua maqquupinasaarusi inutuukkainnartitsiqattarni Nunavummi attanartumi ulureanartumiittailutitsigutiummat tamakku ulureanartumi imaa pinerluutiqartu naalatsianginermut tamatuminga hanuingunnarninginni Nunavummiuni kammalu tujormivimmiiqatinginni ulureanartumiititsirgutiaummat taakku iluunati atangertutik imaa atsuruutiqatsiaqaaliit tamatumunga ikajoqullugit saammartailititsinermu.
The people who ask not to come back because of behavioral challenges, what responsibility does the GN have to those people?
Taakku hoterunnaillissimajuunuut qannu Nunavut gavamakkungi pileriatsahartiuva taakkununga ajuliqsimajuunu taunani.
I don't want to put people in different classifications, but when people are on medical travel, as an example, they're under our care. If it was you or I traveling down on our own behalf, it's up to us as an individual to be able to accommodate the isolation, to be able to return home safely to the community. So that's the dilemma: is where does that responsibility start and stop? We've put in some very stringent measures to protect the safety of all Nunavut, but people that are traveling have to have that level of responsibility, of self-responsibility, that they have a part to play in that too.
Kikutuin na itamako at ziyeng ito ni Pichuta Hasuti au lahat na kaya hangata. Tako ali pilirat sa luat na kayang ikaw pamakuan na akbidak tutik au lahat itaw kataktut. Tako sulay ipigim maginuna buka pamakungita. Kasi na ibiw kang alun ni au lang na rin na Pichutit sa kaluang ilunok tayo mga utiraham ng mga pilirat sa kayaw kaya lang medyo sikisiani. Taman na ka ang iliruti vunaw ko hangak ko pilirat sa kayo ni kayak tabuta magkuha na alat siya sa mga ito galawa kasi ani taman na aw lahat ng mata namin ito ujirit sa alo timalit sa kakalo ang mata.
This is a question coming from the Facebook feed. Trevor Norris wants to know why GN employees are being barred from working from isolation when they spent 11 weeks working from home.
How many weeks?
Pardon?
Say
11.
Oh, 11? Tag na tayo Facebook kapit ko tiyo si Mayo Trevor Norris tapi kayo nung nabugava makungita ko sumangit kami ni kanayak tayo gunay litakat pinasa ko sa 11 ni tayo may gunang nakaktaw law kalawak tilugi.
And that's a difficult question in some respects, Jackie, where each GN employee has a different role. It depends upon what your operational requirements of that department or division has, what your role is in it. Some people are able to work from home or work from outside of the office. Other jobs can't. If you're, data entry, finance, when you're doing your data entry, you can't do it from home or you can't do it from the hotel. It has to be on a GN network. So there are some jobs that can work from home from a distance and others that just can't.
At jiging ito matatako no nabugava makungin ne kanayak ti at jiging ito ne kanaya hangata sulu aulat sinagmo pinay patay kanayangit ilang yang kami ne kanaya kun nakto galo kasi ilang yang kanayang kas magunang kitsa marin matasulo karisaw yang muna kite kinaw yali kunni no nabugava makungita karisaw yang latangin ni kasi natong lutiw ga hangata kasi ilang ang kas magunang nakto galo asule.
Megan Dooling, Nunatsiak News. Keep it up with the job questions. I'm wondering how many GN employees do you know have stopped doing their regular jobs and started working on COVID-related things?
Megan Dooling, Nunatsiak News. Ako kanaya lang ng mapidyo tigilugo. Katsiyo ba nuna wuga ba makungin ni ikanaya mini ikanaya lata mini ikanaya haruner sa tinubadyan ng 19 nga may kamalak to.
Thanks for the question, Megan. It's actually a good one in the respect. I don't have an exact number for you. Obviously, there's different people that are stepping up to the plate in many different facets. I think that out of your question, the biggest thing that I got is that there's not many people that have stopped doing what their normal role is to work on COVID-19 issues. In a lot of cases, it's on top of their day-to-day duties. And that's where the concern that I've had is, staff burnout. When you've still got your day job and you're dealing with COVID-19 related, isolation hubs or other measures, it creates a real challenge capacity-wise.
Yan na may natakutit siya katsiulat mga takaw yung mga Iqaluit nga kasi ni kanaya ring ita minita ma kamat siya kung naksimamata amisulo ang ito tayo makko nuvadyo na 19 na mo pilirat sa hakti solo ikanaya nga takakan ni nga gutamak tumi nga kamanga sikatang ata amalo isumalo nak sikatak tuta ko ikanaya ti takalo kajak ningin ni kasingin ni kamaya hakti lugi tay may mat ikanaya ti katsara ham na musuli isumalo ti haktu.
But I would say the two most directly impacted departments would be Community Government Services and the Department of Health, dealing with the isolation hubs and the airline issues with economic development and transportation. So there are quite a number of people that have taken on quite an additional workload.
Tako agava makupili ribingin natok tao sa manakpano na liniga pa makunilo pijit siraktikot ang maluan na ham nang itulirikot kamagaya hakto tako ni nga inutukay na biyugalin ni halo nani ang malo pivalya yulirikot nga kayulirikulo tamakko nga kayulirin ang mga yun ipilirakan nakakatalaktot tamakko akakan ni nga gumiso kanayang ita kamagaya hakatakto.
So what are you doing, what is the GN doing to make sure that people aren't burning out and also if they are maybe letting some normal things that they would be doing slip to make sure that the things are progressing as you planned before COVID happened.
Nunavut makong kanuili katamakko takalo ko nagit kanayak tingit takwet kanaya nga takakan ningagut pang nataw sa mayunik kano pinirangoban.
Well, and it's very case specific, obviously, Megan. I know of staff that are almost being told to take a little bit of time off as a break. Dr. Patterson can speak to how many hours a day that people in health are putting in over and above their normal duties. As a government, we've given that the extra summer bonus days to encourage people to take some time here. I think it's very important to recognize the work-life balance, and it's harder for some of us than others. But I think everyone needs to take a little step back and talk to their supervisor, talk to your manager to address any concerns.
Tako ato ni nalunay yakta katalo tikisian New York tako aloy kanayak ti langit. Takayak sikay na huyaw katakto ilanik ko kikakay naklutik. Tako luta Patterson kanaya katingi kakasalo ni kanaya katangata kanaya ngatakakan ni gagawa na hamang ituliri kunni. Tako alo Nunavut makong isakir sisimayot aw yakko kikakan ni rutit sanik. Amkhaw yung magahakat tatamakon alimugit sa hangay no usirmini kanaya minilo. Tay mayak ang iyo kami no ukalimakataw nakto ismalo tingini.
We've been hearing from some nurses that they've been told that they can't take time off that they've requested. So how does that fly with what you just said, where you're encouraging extra time off?
Tusak si mamataan na siyo tigo tako kikakuyang ng mataman na yung ilo ano nga kaw sila kataktan no kano taman na kaw sila na kayo.
And that's a challenge when you talk about operational requirements. It's not like some divisions you can cut your staff down over summer months and the workload isn't as high. When you have minimum requirements related to health, we have an obligation to provide that service. And it does put a challenge into maybe not being the exact time that people want to take off. We do have to work with seniority as well too. So we do want to make sure that people do get a break. It may not be the exact time frame that people request due to being able to get, whether it be casual nurses in or other contracted services. So I can assure you that all people, all managers and all leadership are doing our best to be able to give people the time that they ask for.
Taman na lahat so na ko tigil mawala taw gali pidyo tigil lugit ilang kapamagkun ni kanayak beoyot solo aw yakko piniriyat sa kalwa ko ni katangata kasi ni tawlian na tulirin mo tamakko malig sa ila pidyo sa kaw takakahangata inuli sa na kumakuyok takwa hangak ko kikakbigay gumayangin ni angit taw jayot sa ngito galawat takwa ang ayok kaw tit sibuliw te hikak gunak titaw sa mata kasi anit tayo tamakko hikakay nakataw na hulog tayo anasok tayo kay nang natin kanayak tita kaso hatak tugot takwa lo ang ayok kaya yuli mata nalunak bios na mayud ima hikak mayo na hikak titsi kaso ako nakatak hulog tayo awla taw na to akata.
I understand that the Department of Education is meeting today with DEAs about reopening school plans in September. Why wasn't the Department of Education working with the DEAs the whole time to make these plans? Why did they have to hear about schools reopening in the media?
Tukusiyo mayak ko takwa na ilinnak tuliriyikut ulumigo kati makatakam na nga tanong nalin na tulay ko kati mayingin ni matikan nila ng inilin na bi September mi sumalita ko ilin na tulay ko kati mayingin no nalin nito sa katak matikan nila ng mit piwalya yuti ko kisyan.
Thanks for the question, Megan, and obviously I don't have intimate details on Department of Education's activities. I do know that all departments have been working very closely with Dr. Patterson's office on reopening plans, and education is obviously one of the key stakeholders in the opening schedule and plan, and I do know there's going to be more information coming out later this month on the school opening strategy and plan. And as you mentioned, the officials from education are sitting down with DEA officials today, so hopefully that will outline the communication protocols better so that everyone can continue to work together in moving this path forward.
Riyan na may ilulingin Nick, kaya malatang Iqaluit yung kanoy liyo ko tingin Nick, ilinang nilirikot. Kasi nita ko pilir hati khatsa khatak tulut ta Patterson may matukan nila nang mapanaw tilir palia tilugit. Ta ko pilir khatawlo ang anak pa ilinang nilirikot. Amalo to kasi giarotit sa ning sakit to hakkan nila to ilinang bit matukan palia lang ning ita panaw tingin Nick. Tako le kanayak tingi ilinner niliriyik ko man katima katiharner to ilinner to liriyik ko katima yengin ni naling ni lalo na si harner to sawo hanok to sa makatigit sa kanner nak mga tapil katigit sa kanner lutilo.
But why would plans be made about schools opening without the DEA? They're the people on the ground. Why wouldn't they be involved from the beginning?
Sumalita ko pang nauta kapala tilugin na rin ilinner to liriyik ko katima yengin nila o katangila.
Unfortunately, Megan, I can't answer that question. It'll probably be best directed to the department.
Mamaya na galota nakiyugod nang inakutay ko pili ribing atari nga ako biya ka unaksa.
Next question for Dr. Patterson, please.
You should see a doctor.
Dr. Patterson, I'm wondering about the test swabs from the mine. Can you tell me whether or not they had the right swabs at the mine and when they were sent out?
Luta Patterson tako kawya sa kuti katak to jok na bimita ko at sa ngalo mga ta malawalak titaw sa malang mga ta nalo na yon nakyo.
They have the right swabs and media for the machines that they're using at the mine sites, but they are not compatible with either not compatible or have not been validated with the machines that are being used in the southern labs. So when the swabs, when the samples got to Iqaluit on Friday, we actually could not test them and had to send swabs to the mine to be recollected for so that we could test them in the labs in the south.
Tako sela tang mga tayam na bimikaw isa ko tiyo tako na manas malawngin mata malunalo na taw sa magumnalawngin mata kalo na ni tunog sunak ko tangin nakaw isa ko tinut tako talang may tikiti taw law to kalon not ato kun nalawngin at tigo tay may makaw isa ko tit sanita pa nga awlak tit siga kalaw to tay ma kalo na ni kaw isa ko tiyo na tok taw sa ko naksikolo.
So when were the correct swabs sent south?
I think they got into Iqaluit Friday. I'm not sure if they got to Iqaluit in time for Friday's flight. I think probably not, in which case they would have gone out on Sunday.
Kalunano awlak tu angutin ng mga tanalo nakto kisani kay natsingo jami patsa awlak titaw gayak tumini.
You were talking about having a quicker diagnostic turnaround in territory before you could think about removing the requirement to isolate down south. And you said the Spartan tests weren't a possibility that you thought they were before. Can you give us more information on where you are with having faster diagnostics in territory?
How is a good chani tamani no navumi house kayoga vita ma hilame na sakota ko alo Spartan gunarakto yut atuti gunda yung mata tukisitit sigat kanero nakita mani how is a good na utakang mangmuno na builoan.
Thanks. Just a longer discussion. So the Spartan device is approved for research only. It may become available for proper clinical use at some point when all of the problems have been solved. But until then, we have no idea when that device will become available. I'll let Uli, I'll try to chunk it up. So
Khoyan na mi iyaku ta na ko na lo kiu gun nakta kalwa kata ko apit tigil lo git Spartan khawi sa uti na kaktaw yu sulang yaktaw si mamata khawi sa uti sa uti naklutik amalo kigli sine ako ti lutik tama inuli sa inak mo sula khawi sa katsaw ngim matas tamakwa ka ngili ko ti ningin lalo na yaktaw law ningin ni lalo nakto kanga ko to kun naksijaw gayang mangata.
we have gene expert devices, one here in Iqaluit and now, for a little while now, one in Rankin Inlet as well. But there's still a worldwide shortage in the number of cartridges or test pouches that are available for it, and so we can't use it for our day-to-day use. We get 20 to 30 cartridges a week, and in an outbreak we could we could use up the amount that we get in a month in 3 or 4 days. So we reserve the gene expert for situations where it's a delay of even a few days is too high of a risk. Elders' homes, other congregate housing shelters, situations like that. And I don't know when they're going to solve that shortage. Thought I could squeeze in that last sentence. Sorry.
They made the gene expert me kaya sa ko te kakalo akto ko tamani kalunni amalo kaya sinang me they made to simalektot nunak jali mamila amigak simata tamakuni nga kaya sa ko tinik pus simayolun ne kaya sa ko tinutat sumunga sunak ko tama toktaw galim tikiti tayo katakto ko 20 nik 30 nilo ila ato katakto ko man na yok 20 nik 30 no pinasa ko si tamat kasi anili siyang maktokalang nakad isumalom na kayang atako nungot siya tigi kayang ataulo ni pingaso ni si taman nilo ni tako sa nakbaksi mayago J-Nex pamukhawi sa kutiyo kasi ani at kingo bakayak to kang nakad ulo ni tamak ko nung isumalom na kayang atamak ko siya makbiw nakpangagum nakto ni surlo inay ang ikangin ni ubalon ni ilo may katigigasan ni dahil may isumalom na kayang at dahil may mat sa nakbaksi makataktab.
The third device that we've discussed before is the BioFire, which it runs a panel of unlike Gene Expert and Spartan, it doesn't just test for COVID. It runs a panel where it tests for, I think it's 14 different pathogens, bugs or germs that cause respiratory tract infections. I'll let Uli interpret that.
Tana pinga joat sanakutakaw sa kutiyo ate kaktok BioFire. Dahil mahadjiging itangatat sa Gene Expert ang malo Spartan ngunilaktaw yun. Tana kaw sa kutiyo nang ataw sikut 14 nik tamakuni nga siyang magunak tunik ipinali ko taw gunak tunik.
We have one ready to go here in Iqaluit. There's one in Rankin Inlet with renovations happening at the health center there so that it can be properly set up. And the device in Iqaluit, I think it might have started the lab staff may have started the work to get it validated either last week or this week.
Tana ikalod ni ito kaw sa kutiyo ang malukang sinang mo tayo kalaso ni daynan sana jaw gyalaw tilugo kang sinang mito ini kat sa lilangat tana kaw sa kutiyo ikalod ni pigyak taw sumalak to tako nga ang yaksibim me kanayak tinot pinasa ko si ulo to mi balata pa ni pinasa ko sa me tamma katta kayang kalawang mga kaw sa taw kanlian.
It sounds like the manufacturers of BioFire will be able to deliver enough cartridges to meet our needs for even our routine testing. But I don't know exactly when we'll be able to start using them. I don't want to give a date because I wouldn't have guessed we'd be in July and we're still having this conversation. And we've all heard things and then it just doesn't pan out. So we're figuring out if we can set up a system where with the 2 biofires we can do all of our testing in territory.
Tana company yok ila sanga siuta ko nga biofire ko niraktaw yunik atu khatta ko naksigayak to jabot khawe sa ko teo khatta lo ni kisa na khangak ko mga khawi manang nitok ulungan ilo nalo na simayo kakani tamani July mi unya suri ya kalo avo kisa tamani suli o khaw sa rito nakpavo sulit pisimangin atigo tako mako khawi sa ko teo yu atu inaw lek khati khalon ni kang sinak milu tamani no na vum khawi sa ko titsa khalero naksigayak to.
And just one more little tidbit. I get it that everyone's frustrated with how long it's taking, and I appreciate the patience that people have shown. The reason for doing it this way is these devices have been validated. They've been approved by Health Canada and internationally, and we can incorporate them as part of an overall healthcare system where the testing is compatible with the labs we work with in the south, where we know how reliable it is, and it just fits well with our entire response, not only to COVID-19, but to other pathogens. This device lets us test for pertussis. It lets us test for RSV and a number of other pathogens that we deal with on a regular basis in Nunavut.
Ilagay kan ni galalo tanay la ako ni ulo alang ngani tema kuya ligalo akto ngotak kikun nat siya ngata tako na lunak taw si matsyara kang atangik taw si magya sutiluan na hanang itulay kun no kanatami nunak jo amilo taman na tu ila liu tiu siya kayak to na hanang itulay jo sitin tamani amalo awlak tit siya katalo takalo na no tak tama tam maksimang itunik kaya matsyara lo tigulo tam makatta kayang inning Tana no badyo anak 19 mutuin nak toka nga gayang imat kasi anita khursong nak tumo kanimamut amalo ipinang nak tumaras bing nakaktaw yung mutamakwa kaya sa kutiusin na ngo kataw nak silangat.
And so then when we have those machines ready to go for diagnostic capability in territory in Iqaluit and in Rankin Inlet, and the curve, like transmission looks low in the southern locations that we travel to, is that when you would be comfortable to get rid of the isolation requirement?
Tako ito inaw tsalik katakawi sa kutiyo yu tayo maalita gano na vumikawi sa kutit sa kaknakailig kayak kita mani kalun na ikang sinak milo amalo kalunani siya mapalagun niya naksaw palalang nakatema akaksali kayak kita ko
Yeah, that's the discussion that we're having in the Department of Health and in my office right now is the possibility of altering the measures, at least partly, when that becomes available.
Kaya matagaw ko sa khatak palyalak tiban na hamnang itulay kunita at sumaan labing ani tako ato inawlak katakaw sa kutiyo yu asidjak tayo kung nakayak kumanik tayo kaya hakti tabo.
Ken Frisco, ABTN National News. Dr. Patterson, you mentioned getting replacement swabs to the mine. The mine, from what we've had explained, is isolated from the rest of the territory. How do you go about getting those replacement swabs to the mine when it's isolated?
Ken Frisco, ABTN Dr. Patterson tako aking ubiutit sa yu yakang nagbim mekawi sa kutit said tanaw yakang nagbiu pataw ga hakti nagwas ngin nino na vumingak tunik kanuli tako tikititaw la katay may galawak tilam.
With a charter flight from the mine to Iqaluit and back.
Hangat atitaw yukut tamangat ikalunni ngalunni ujakang nagbimutay mautikon na tuwin nakayak tuta na hangat atitaw yu.
And the exchange happened at the airport, so exposure to Nunavut is very small and no different from the other flights that happen on a pretty regular basis, and especially in Nunavut, aircraft are and the airline industry is essential, if not critical. So.
Tako tuni jaw hatta kayang ata hanga tayo kuvimi amalo sa magunak ni ngani sa malod na kayang matay ma hanga tayo nunavumi awla kata hatta unang ata tayo mga lima tako alo hanga tayo lirin na taman na pimakayumat inusitin no.
You don't have to look very far online to see photos of Nunavut teachers on vacation in the South. I'm wondering, due to the request to go through the hub on the way back, do you have any idea of the number of teachers who decided to ignore your advice and went south this summer?
Tako nakatang ano na bumiyo ilin na atit si Iqaluit to kalunani tayo mali utilik kata tayo mag inutugya kala ningin no taman na isumalon na ka.
No, I don't.
Aga.
I'm wondering, do you have any concern that come mid-August, when teachers who left and new hires who will be coming in will have to go through their 2 weeks of isolation, do the isolation hubs have enough capacity for that and the medical travel and the other people?
Isumalo ta kaki sulo August nung ani ila kiti ani tamakano ta tamalo utang na tulin na tutsi utak pala kata makuni pinasa ako sini tuyok may bimigay na kaya kalamin mata ini katsala tutsawa ta makkakan ni ngagawa na bila kataktoy.
Thanks. It is a bit of a concern, and it's why we changed the process a little while ago. When the hubs were originally set up, we didn't want to book weeks and months ahead because of all of the uncertainty around it. And as we're moving into summer, knowing that if the hubs are still active, there will be increasing demand in August. We've been asking people to book ahead to try and get an inventory of what it's going to be like in August. And so, there may be a time where we have to get more rooms, but we're still figuring that out.
Kuyan nami taman na ilang sumalom nakto tayo may message lang sumababo tamak ko malit daw gali to yung may bimigay na kitaw gaham mo pinasa ako sa kasayro balutak ka kasay sibong kagut init saliw katalang ito ko taman na nalong nakmin kung ano kasi ani aw yaw laktin lugo tamak ko sulit inuto kataka hakata to yung may bini nalo nang mami song lang ata agas ngulik katay may mat init saliw katako ilak ko agas muno ila utak palya no takwa ilo sa hakan nira kana mga ta khawjiga khalaqata.
And I almost forgot, as of last week, there is a second hotel available for general travelers in Ottawa, and it's partly because of increased general travelers, but it's also as the hospitals open up and clinics and specialist clinics in the south. There's more Nunavut heading south for urgently needed medical travel that had been delayed because of the closures in Ottawa. So there's multiple reasons for it.
Penasa ako siulak to me dan ko sa yugat ila tulian ito yung may minalo na taw sa mayo kalek to tamak kuno nga pityo ti kalawang ito no tamani arwa mi nga katakayalin not inutukal na katakayalin not malutaw na nakalo na ni Anna Belo mati pallalak tilugit ang maluluta makit ato na naksaw tilugit nuna bumiyo taw nung naksaw katalang atatamak kuning ato avang nakto ni Anna Belo ti kakayalit kingo bakak taw simalaw nga taman na pidyo ti gilugot at sige ngito ni pidyo ti kaktugal wa kisani inakakan nila to.